Let's talk to an expert who was listening in on that press conference with us, Dr. Susie Hota from Toronto, a leading expert on these infectious types of diseases, has been with us for the past couple of hours, and we appreciate you sticking around so much because, of course, major breaking news in this country. But again, to not sound alarmist, this person is alive and they're being taken care of in a hospital. But immediately we're getting the sense from folks, and you're seeing reaction on social media, you're seeing reaction from people emailing, asking questions. How worried do I need to be? So a patient comes into your office and says, look, I'm from the town that this guy lives in, and I was just at the airport as well, or I might have ridden on a bus that he might have been on. How worried do I need to be?
So again, I think information will continue to develop as we get more, more information, I guess, data from what's happening in Wuhan. But let's just keep this in perspective. This is not something that so far we've seen is transmitting very, very easily from person to person. So,
you have to be very close, they said.
Exactly.
Okay.
Close enough. So, these are viruses that tend to travel in large droplets that are generated when you cough or sneeze, and if you're infected with the virus, and especially when you're really sick from the virus. And so those large droplets really don't travel very far. They go maybe 2 meters away. So if you're just sharing a room with somebody who may have this infection, your risk is still, it's low. It's that kind of contact that you need in order to get infected.
Okay. So let me play devil's advocate in this situation where the worst scenario might be that the person sitting next to this man in his 50s who is traveling back from Wuhan, he's sitting next to someone, the patient coughs, that's very close. And let's say whatever virus he was carrying gets transmitted into that individual. We don't know about this person now. And let's say that person took public transit home and has been in contact with a number of people in his or her office, in his or her family. Right. How do medical officials in this country go about figuring out where all those people are?
Yeah. So, I mean, the people who are in closest contact with this individual are the first sort of ring of individuals that they will be looking for and giving advice to and monitoring. So, public health right now is very busy reaching out to these close contacts, household contacts, people who would be on the same row as that individual on the plane, as well as, up to 3 rows away from that individual because of what I mentioned in terms of how far these droplets could actually go. So, really prioritizing the highest risk individuals. And the first thing you're going to want to tell them about is educate them on this whole issue and the illness. So what symptoms to look out for? The early symptoms can be fever, it can be cough, or just, sort of respiratory infection symptoms that you would normally get like you would for a common cold or a flu. Or some people will get shortness of breath. So making them understand what to look out for and understand what they need to do if they do develop symptoms. It's not going to be your usual how you manage your cold. This is something that would be very serious and would have to be reported to public health, and any healthcare facility that this person would go to would have to be aware of that in advance. So those are the pieces of advice and the kind of monitoring that would be happening.
Okay, to that point, I should note that the Deputy Premier, Christine Elliott, did mention that the province has set up a website that is specific to this type of coronavirus. Let me just pull it up for you. I have tweeted it, folks, if you're looking for that information, at Natasha Fatha, and you can find it there. But this is ontario.ca, and it's a page specifically for Wuhan novel coronavirus 2019. And it goes through a series of things of how to protect yourself, what to do if you're feeling sick after travel, what are possible areas of lab testing, how the province is preparing. So there's lots of important information there if you're looking for that. So certainly information constantly being updated and being made available. But about that press conference, I wondered what you interpreted by the fact that it was so well organized. What is the statement, do you think, these health officials are trying to make by having 6 or 7 of them sitting together? It's well organized. Why not just put out a press release and say, hey, it's confirmed, we're watching it?
Oh, I think we've learned a lot from the past. First of all, addressing these issues before rumors start to go and head on. And that's exactly what they were trying to do here. Some people were questioning, why are you coming forward when it's a presumptive test test positive. What does that even mean? You know, and I think the answer that was given was really an excellent one, where you can see the advantage of having these additional days to actually move forward with getting people aware of what happened and following up. So that was one message. The other message was we're all working together. So various levels of government, public health, the physicians, the hospitals, you know, everyone was there together, and it was a unified message that they were giving. And to me, it was a message of this, all the system worked, it all played out the way that we expected it would have, you know, being prepared to deal with this kind of situation.
Okay, that's a really interesting way of looking at it. The system is working. Yes, a person got sick,
Right.
but the protocols were followed
That's
that are
right.
necessary.